Again, my name is Stephen, and the work that I'm looking to chat with you guys today is a resource that I developed as my final practicum project as part of my master's that I completed end of December last year. So it's all fairly current and I think is still very relevant to the work that's going on in the field today. So before I get into things too much, I just want to say that this project certainly wouldn't have been possible without the support of the Faculty of Nursing at MUN, in particular Dr. Joy Madigan, who was my supervisor on this project. And a huge, huge debt of thanks is owed to my peers, coworkers, and certainly the leadership with Niagara Region Public Health, who were very, very supportive of this project the whole way through. When maybe ironically, I was talking to them about burnout to the point that maybe it was a little bit of a risk of burning them out with me approaching, looking for interview subjects and lots of feedback along the way to make sure that the work that I was doing was relevant to their needs and the stressors that they were facing and I think continue to face. So just a quick project overview. So burnout is certainly a growing concern with COVID-19 and adjusting to the new normal, which I think is considerably more stressful than the old normal for many of us. This project was looking to assess impacts of pandemic nursing and epidemic nursing on public health nurses' perception of burnout, and then based on an anticipated increase, to subsequently then develop a resource that would help support nurses through education, self-care, and peer support. The resource that was ultimately developed is an e-learning module focusing on educating nurses around burnout and self-care, and there's a peer support component to try and help nurses support one another. And through an evidence-based approach, integrating nursing theory and science, I really believe that resilience can be strengthened even in the midst of pandemics creating such stressors for our nurses. Really, there was, if I could take a moment for a quick anecdote, this project was really inspired by a period of time that I spent working in public health and being redeployed from a position doing mental health work to help support the COVID pandemic efforts in case and contact management at the time. Initially, I had envisioned a project focused very specific on mental health things, and that's kind of the lens I was looking at. But the first day walking into the pandemic response efforts, it was very eye-opening. I was walking through, looking for my new desk, and I could hear the nurses just chatting to one another as I walked through, and they were in great spirits about things, but it was kind of like a bit of joking and some kind of one-upsmanship with discussing their workloads. They were talking about who had worked the latest that week, who had worked the most consecutive numbers of days, and they were putting forth really Herculean efforts towards protecting the community and doing amazing work. But the first thought that kind of went through my mind, other than being impressed with their efforts, is I don't necessarily think that that's sustainable. And I worried that burnout would be a concern for nurses in general. So it really led to me switching gears and moving towards developing this project. So the first step in that process was conducting a comprehensive integrative literature review, looking for terms like pandemic and epidemic. I mean, pandemics are thankfully historically very few and far between, but I think that the research done in more localized epidemics was certainly applicable to, at least on a smaller scale, to the situations we're in now. Looking at search terms of burnout and stress and compassion fatigue, which certainly compassion fatigue is a slightly different phenomenon, but I think there's huge overlap between burnout and compassion fatigue, and the literature supports that. And of course, looking at interventions and treatments to address those issues. I also widened that search, looking kind of at the historical evidence of pandemics and epidemics exasperating risk of burnout. So I focused in adding additional searches about HIV, AIDS, MERS, SARS, H1N1, and COVID-19 and Ebola to try and narrow in on some more specific examples of epidemic and pandemic nursing. And as you can see, with 46 articles included in the literature review, there's a huge abundance of literature on this topic available. So it was good to be able to dive into that, to have strong evidence to support the work that came out. So as far as the key findings in the literature, there's just ample metadata that supports burnout being a concern for registered nurses in general, and then being exasperated by epidemics and pandemics, like all these past health crises and even early literature. When I started the lit review, it was, oh my goodness, I guess spring of 2020. So we weren't even very far into the pandemic, and there was already literature coming out that was supporting nurses reporting higher instances of burnout. So we were seeing, I'm seeing evidence that all of these types of crises and all of these strains on resources, including those emotional resources, were leading to exasperated risk of burnout. Again, strong links between pandemics and epidemic scenarios in increasing the risk of burnout. And that to me just demonstrated a powerful need to integrate and employ interventions. And of course, I think it's important to demonstrate like why this matters. We can say that burnout's associated with all these things, but then the question, of course, is so what? Nurses experiencing burnout reported decreased satisfaction with their work, decreased satisfaction with providing care and interacting with their clients. This also leads to consequences in client safety and in decreases in the quality of the therapeutic relationships, really impacting the core of what nursing is and what it means. Nurses often consider leaving their current job or the profession altogether. Folks just reach a breaking point and they look, whether it means trying to find another nursing position that they perceive as being maybe a break from what they're doing or less stressful, or to just leave the profession altogether. They just don't feel that they can stay doing what they're doing for sustained periods of time. And all of those issues, to my mind, were especially troubling as I was reading about the nursing shortages and as hospitals and public health units became increasingly stretched thin, trying to address the issues that we've been facing. Turning towards the interventions that can provide some support to our nurses. The literature is very, very clear in that it supports us taking steps to prevent burnout, and those steps can be powerful and effective, and I would argue, and I think very cost effective in trying to address these issues and prevent it from getting to the point that we're losing nurses to stress leaves and we're losing nurses to just not wanting to remain in the profession any longer. Self-care strategies were very, very strongly supported, particularly mindfulness-based interventions, with I think the lion's share of the research kind of being geared towards mindfulness-based stress reduction techniques that you'd see kind of endorsed by John Kabat-Zinn and the Mindfulness Institutes out of the United States. We see support for digital in-person strategies that can teach nurses mindfulness, and that was noted to be particularly useful in addressing emotional exhaustion. Yoga was another intervention that can be practiced alone or with others that has been deemed to be very efficacious and have positive impacts. And even just making healthy choices. So that kind of meant like not necessarily taking on new intensive challenges, but just healthy diet, moderate exercise routines, like taking somebody and having them adopt like a new rigorous exercise routine has been tried. It was deemed as ineffective. Folks find it burdensome to be made to do extra new, hard, challenging things in addition to the difficult situations they're already in, but making sure that they're having time to engage in those healthy routines that, going for a walk, things like that have certainly been shown to be very, very positive. So wanting to try and turn to my peers to see what's effective for the folks that I was actually designing this resource for, I held a series of consultation interviews. There were 6 frontline nursing staff and 1 clinical manager that were interviewed over the course of about 2 months. I was really looking for a varied background, not just wanting to focus on one program or department, because I think like so many of the areas that I'm sure that you guys are working in, the differences in the day-to-day workload and day-to-day structure of the work for one program to another in public health is very different. So I wanted to try and encapsulate as much of that as possible. So I spoke with folks that worked in mental health services, vaccine preventable diseases, school health, and about 2/3 of the nurses were redeployed to do COVID-19 work in one capacity or another at the time of the interviews. And the manager I spoke with was a clinical team manager with our mental health services. Format was semi-structured interviews with open-ended questions and lots of opportunity for folks to try and provide their insights and their experiences in dealing with burnout and COVID-19 circumstances. So some of the key consultation findings. All of the nurses reported that they think that the profession is at higher risk of burnout. 5 of the 6 nurses that were interviewed personally felt that the risks in their lives had increased with since COVID-19's impact. And interestingly, the 1 nurse that didn't feel that she was feeling more burnt out was a nurse that was in a part-time capacity at the time, and she made a point to say that the fact that she has several more days off to spend with her family was her solace, and was very upfront saying that if she was working a full-time caseload, she felt that the risks would be higher for her as well. So I kind of took that one with a bit of a grain of salt there. Evidence of burnout was noted in several of the nurses, particularly emotional exhaustion and some negativity towards their job. And folks were very clear that, like, historically they loved their jobs, they were passionate nurses, and they were good at what they do. So it was frustrating for them to even feel that negativity. So speaking to the seriousness of the issue, loss of usual supports both at home and at work was noted. So and that's the social element. With COVID, with all the lockdowns, with the restrictions, people haven't been able to spend time with extended groups of family and friends at home the way that they had historically, and even at work. So many of us, we look forward to having a coffee with a work friend, or those after work gatherings, things like that. And with all of that kind of coming to a halt, that loss of support was very, very much noted. Common themes noted were increased workload, lack of control and preparedness, and safety concerns. I will note with safety concerns, that was kind of a specific circumstance that I'd like to just quickly speak to, because I do think that my employer has done a phenomenal job in ensuring safety and that folks' needs are looked after. But when I did my initial interviews, it was during the early point with COVID that I'm sure a lot of you folks can remember and maybe relate to, where there were oodles of news articles debating, do we need face shields? Do we need a surgical mask versus an N95? Is COVID airborne? Is it droplet? And there was still so much kind of miscommunication. There was still so much uncertainty being perpetuated in the media that even though the organization was following all the best practice guidelines, people still felt that maybe they were unsafe, or that they were potentially at risk of bringing something home and impacting their own families. So in asking during those interview sessions, I tried to ask about what they felt a resource that would be useful to them would look like. And luckily, as nurses, we tend to be pretty vocal about the things that we like, so this was great. Everybody told me nothing long and print-based. If I was going to give somebody a multi-page document, they weren't going to read it. They didn't have time, and it wouldn't be something that would be perceived as helpful. Web-based e-learning modules were very familiar. It's a way that a lot of education is done internally with my employer, so it was something that was familiar and liked by most people because you can start and stop it as you see fit, and it's kind of done at your own pace. And a big thing that I thought was interesting and important to note is organizational support was universally deemed critical in having good uptake. By that I mean, if the organization didn't say this is something that's important and we're allotting you time and support in doing this, it would be perceived as burdensome. Even if nurses were offered a phenomenal resource, but it would become one more thing that they had to try and cram into their day in addition to meeting all of their other work targets or be suggested they do after hours at home, it would be interpreted as being burdensome. So it needs to be something that the organization feels is important enough that we're allocating time and energies toward and not just trying to make it one more thing. So in developing the resource, quickly realized that burnout is something that addressing is going to be multifaceted. Education is huge. We have to be able to recognize and subsequently address the issue. And I think that that's addressing it in yourself and as well as recognizing and supporting peers. Self-care tools are very, very important in the current climate, especially when so many kind of in-person type groups and more formalized structural social things are really not options at the moment. And nurses have a need for peer support. So in developing an online learning module, self-care, I wanted nurses to have some support in recognizing and then assessing burnout, and then learning some self-care strategies or reinforcing some of the importance of some different self-care strategies that they might be able to use. I wanted to offer a tool to be able to try and formally recognize, trying to help people to recognize things. I think sometimes we're very good as nurses, we're very good at helping to assess other people, and we recognize when our peers are struggling. But I think we can sometimes throw ourselves into the work and maybe not focus on ourselves as much as we need. We kind of put ourselves on the back burner. So I thought that having a series of questions that you could try and answer as objectively as you could and provide you with a score might be useful to try and go, okay, you know what? I thought maybe I was just feeling a little tired and irritable, but I've done this little quiz, and you know what, maybe it's more going on than I was giving it credit for. So I thought that was kind of a little external indicator, and I chose to use the professional quality of life assessment tool for that. I think it's a great tool. It's been validated and used in lots of clinical and research settings. It actually has 3 subscales. When you score it, it's a single-page assessment. It's quick to do, quick to score, but it gives 3 scores: secondary traumatic stress, burnout, and compassion satisfaction, which I think are very overlapping concepts. So it's certainly a useful tool. There are specific tools to just assess burnout, like the Maslach Burnout Inventory, or the MBI. It's probably the most commonly used one in the literature, but it's pay to play, and I really didn't want it to be anything that would be too clinicalizing and something that if other organizations are looking to adopt it, I didn't want it to be, like financial implications of it being a barrier to using an assessment tool. And the online learning module is designed to educate nurses around the peer support strategy that I developed as well. And that peer support strategy came in the form of a virtual coffee break. I thought that was a really interesting approach to take, and it was the idea came from a study that Nadler et al. Did in early 2020, actually focusing in on COVID work. The idea is you have socially distanced peer support, whether in person, like kind of sitting spaced out around like a conference table, if that's how your team is structured, or if you've got folks working from home or working at different offices or different kind of cubicle setups where that's not really an option, you meet over Zoom or whatever platform your organization is using, Skype perhaps, and that way nurses can have a brief daily check-in with one another. And the purpose would be to check in and to ask folks how they're doing, and as opposed to focusing in on like scheduling or client issues. So it's really meant to be time to check in with one another. So just to try and show you a little bit of what the module itself would look like, I've screen grabbed a couple of slides from the module that just provide the overview, and I'll just quickly go through those just so you can see kind of what the content would look like. So starting with the theoretical framework, I'm a big proponent of Watson's theory of human caring, so this whole project was based around that. So I tried to provide a little bit of context, and I think that for some folks it can be validating to have that theory and to go back to Watson's work emphasizing how caring for the self is an important component to providing quality care for others. Then moving into the more the nitty-gritty to the understanding burnout, focusing in like what is burnout. I use a case study in the beginning and come back to it in the end because I think it can be good a case study can be a really good way to contextualize and to frame some of this learning, looking at the signs and symptoms of burnout, risk factors, and the impacts of pandemic nursing on nurse well-being and burnout rates. Then moving into the assessment piece and some direction on completing the ProQual 5 for those that are interested in doing so. Then strategies, so focusing on self-care, prioritizing your own well-being, the healthy choices, and again, as discussed earlier, mindfulness is a hugely efficacious approach, and I think it's one that's effective, and I think it's easy to teach over this type of medium, so it felt like a very good choice to put a lot more emphasis on that. And then moving into the peer support component and educating nurses around the peer support strategy and some of the supplementary tools that were developed to go with that to try and help folks to be able to be open with one another and maybe share. Like there's a whole burnout support plan document that I would encourage people to share with their peers. So that's all covered in this section. And of course, I recognize that this tool and this module would be, I think, it would be a great thing to bolster resilience and to help to mitigate some burnout for folks. But there are going to be individuals that need certainly more formalized supports. So I've included information on how to access more formal supports like the Employee Assistance Program, encouraging people to reach out to primary health care providers if need be in order to get connected with more intensive services like counseling or what have you, like to make sure that they are looking after themselves and their peers and their families. And it's a little, almost a little off topic, but there is a little piece at the end focusing on how to support clients. I recognize that for many of the nurses, some of the frustration that they were having was feeling like they weren't being able to support their clients who were certainly struggling in the community. So their feelings of frustration and some of those challenging emotions they were having were sometimes stemming from not being able to feel like they were effective in their roles. So I thought it would be important to have a little bit of that information as well. And finally, like how to learn more about these topics. And I had reflection questions, which were assessments of the module's effectiveness and their interpretations of things. So looking at the lessons learned in developing this, burnout is a hugely real concern for nurses, and I think the current climate has really created an unprecedented risk. Even small-scale interventions can be powerful. Small, cost-effective, not terribly intrusive on time and schedule type interventions could really have powerful impacts and lead to some meaningful change. All of those types of interventions to be effective, I think, really require support from organizations and employers. Being proactive and upstream approaches to managing things are certainly the most cost-effective and important to maintaining nurse wellness. I think that that's true of all areas of healthcare. It's always easier to prevent illness than it is to treat it. An effective intervention strategy is useful I think in the current climate, and I also think that this type of resource is useful because as much as I hope that this is a once-in-a-lifetime thing and we never have to play this particular game again, we never know what the future will bring. So I think having plans to deal with these periods with escalating stress and increased support for nurses during these times, I think it's a great thing to kind of have in your back pocket. So I included some information here on my organization, and I think I felt it was important to leave this here because I'm sure this is true of the areas that many of you work. There are already very powerful and numerous tools in place that organizations and employers are really trying to have things in place for their staff. So the link on this page goes to an entire staff resources page that we had on our internal website, and I just wanted to try and demonstrate the fact that the resource that I developed here, I think, can be something that fits into existing kind of suites of resources and can help to supplement what's already there. I certainly wasn't looking to reinvent the wheel or to try and completely throw out what was already there. I think it's just a matter of we need to add to some of those already very important and powerful tools. And I noted that in the case of my current employer, there was substantial overlap with some of the work that I created and the skill building and self-care sections of their staff resources. So I think that it kind of integrates and builds on that. And I think that the e-learning module and the peer support piece the organization being a little bit more proactive in bringing the skills to people rather than folks having to look for them. It's just a different approach and kind of supplements what's already there. And I'm sure that for anyone who's interested in this module, and I'll happily share everything that I've done here, I think that may be the case with your organizations as well. So as I said, Niagara Region Public Health resources were excellent. They had a wide scope and they were phenomenal. The leadership was very, very supportive in this area. My concern was simply that they had to be thought out and integrated by individual staff members, and I wanted to try and provide, especially the e-learning module, something that was kind of coming to them as opposed to them having to look for it when they're already maybe feeling that there aren't enough hours in the day and maybe feeling overwhelmed at times. And again, that was supported with the consultation. So that e-learning module really helps to ensure that there's kind of that baseline education amongst all staff around burnout and the supports that are available to them. And some of that is just, again, pointing them into the direction of the things that we already have. And being social is such an important component of wellness. And in our wellness guide, it's identified. However, with the limitations placed on social connectivity during COVID, I think that the virtual coffee break can be a strategy that could really potentially meet that need. So just looking a little at evaluation, I think that any type of resource or educational piece, it's always going to be a work in progress and should always be adapting to the needs of the target audience. So that's why I've included, as I mentioned in the module overview, there's sections at the end to obtain feedback and to try and evaluate things. I used a 5-point Likert scale for that to try and be able to do a little bit of statistics because I'm really cool like that and would love to crunch the numbers if I were to get a wider rollout with this resource. The virtual coffee breaks aren't really as effectively evaluated in the same way, so I think I would envision it being assessed with a convenience sampling, where you could just check in with teams to make sure that it's effective and that it's meeting their needs, and it's not just becoming like, it's 15 minutes where we meet in the morning and we do scheduling things, because it's losing the spirit of it and not necessarily meeting the needs. And I think that having an opportunity to anonymously offer feedback, which with my employer, we have an option to offer anonymous feedback through the website. I think that would be an important resource to try and get accurate and honest feedback from folks. So looking at just the next steps, I acknowledge there are certain elements of the module as I developed it that I would need to work with. If they look to go forward with it, I would need to do a little bit more tailoring and trying to make sure that everything is in line with and correctly reflecting kind of my current organization and the work that's going on there. I would envision the e-learning module being rolled out first, because I think the e-learning module would provide the education and the context for the peer support piece. So then the module would basically naturally roll into kind of introducing the peer support. As far as information dissemination, if somebody is so inclined to want to read through the document in its entirety, I believe it's already uploaded onto MUN's library. A hard copy has been put into the Niagara Region Mental Health Staff Library. And this is already being presented to leadership with public health, and I'm continuing to look at exploring implementing perhaps elements of this, and have been emailing with our health and safety program advisor to hopefully look at next steps. I mean, as I'm sure any of you are keeping up with the news in Ontario, things have been pretty weird and wonderful here over the last number of months. So it's a lot going on to try and be implementing big changes.